One aspect of the reform package includes spending money on computerizing health records. How many of you are in support of that? And how many oppose it? Yeah, I would like to hear what each of the panelists feels about that aspect of the plan very briefly.
Certainly facilitates quality health care and the ability of people to change their healthcare system without a interruption or a lack of information to the next provider. So it's critically important to improve quality of care.
When I was practicing medicine, you know, I couldn't really tell how well I was doing with my patients, and I'm sure you can identify with that. With paper records, you just can't keep track of people. You don't even know how many of your patients have certain illnesses and how well you can control it. So computerization is absolutely essential. Right now at Kaiser Permanente, we can tell how many people have high blood pressure, how many people have it controlled, how many people have diabetes, how many people have that controlled, and we can track it and get the system to try to get better results. And that's the value of computerization.
Ms. Leslie?
I think in my years in healthcare, one of the most common complaints I have is one doctor doesn't know what the other one did, and we'll never solve that unless we put in computerized records.
Mr. Flanagan, in addition, bring up your other point as well after you answer this about computerized.
On the medical privacy issue, you can imagine if you're from California but you're in a car accident in Florida and you're knocked unconscious, if you have your license on you, if you get to the hospital with an electronic medical record system, they can find out that you're allergic to a painkiller or whatever the detail of your medical record is. So it's really important. We heard recently about Dennis Quaid's two young girls who were given a dose of medicine 1,000 times the required amount, and that's simply because the doctor's order wasn't linked to an internal computer system in the hospital that detailed what needed to be prescribed. That's a critical aspect. But as a privacy advocate, I also want to make sure that as we're developing medical records to be online and database, that they are also protecting our privacy and that information about our medical records aren't being released or gotten a hold of by the same folks that are breaking into our visa bills and getting those kind of information. So privacy and medical records need to go side by side. I just want to make one other point on the architect of the plan itself. One of the basic concepts of both the House and Congress bill, or House and Senate bill, is to base the benefits on the Federal Employees Health Benefits Program, which is the benefits program that the President and members of Congress receive. And you know, that's a basic concept of the architecture of the bill. So to say that, that somehow the plans are different is just not correct.